Hi, this is Meg Obenup. Welcome to the Taking Care of Tutu podcast. Today, as our guest, we have Thomas Harding, who is the owner of Maui Memory Clinic. Welcome, Dr. Harding, and thank you for coming on the show.
Thank you for having me.
So I would love to know a little bit about your background, how you decided to do what you do, what kind of schooling that you have, and how you ended up here.
Okay. Well, I started off as a neuroscientist. I was a bit of a lab geek working with animals and trying to figure out what kind of neurodegenerative diseases we can get, such as stress, which is something I did quite a bit of work in. After neuroscience, I went into neuropsychology because my colleagues were saying, you should be working with people. You're a bit more personable. So I started working with people, assessing brain function. So as a neuropsychologist, I would meet people, do the clinical interview, and then we take about 2 hours of testing so I can find out what parts of the brain are working good, which parts might be weak. And then that helps me come up with a diagnosis. And quite a few treatment teams like primary care physicians, neurologists, they send folks to me when they want to have a deeper understanding.
And what's
For
your
example,
education background? Like what kind
okay,
of
so I
background?
started in neuroscience as a graduate student over at University of Hawaii. And so neuroscience, and then I started a graduate program in neuropsychology here in Hawaii, over on Oahu. I went over to Omaha, Nebraska. I worked with in a brain injury rehabilitation hospital. I did quite a bit of traumatic brain injury before I started working with neurodegenerative disease such as Alzheimer's and vascular dementia, Lewy body, that type of thing.
Yeah.
So those are the two areas that two populations I work with the most.
And then, but your educational background is you have a PsyD in psychology.
Oh, yes, I have a doctorate in neuropsychology. I have a master's in neuroscience.
Got it. And then did you do all your college and your graduate work here in Hawaii?
I did, except for the residency. I did go to the mainland and
Right.
worked over in Omaha, Nebraska.
And so your private practice is called Maui Memory Clinic, right?
Maui Memory Clinic, we came over here back in 2018 and we started a Maui Memory Clinic then.
Okay, got it. Makes sense. All right. So will you tell me sort of an overview about the services that you folks offer in Maui Memory Clinic?
Sure. So let me just show a picture here. Neuropsychology services basically involve assessment or, cognitive testing to find out what parts of the brain have been injured, like if you were in an accident or if you're starting to have slippage in senior moments with neurodegeneration. We will find out what areas are still working good, which areas a little weak. We
Okay,
also,
got it.
so if a primary care physician, so let me just show you just quick memory screen. If you go to your primary care physician, they may do a quick 10-minute screen on you. And if it looks like you're struggling with that, they'll refer you for a more complete evaluation, which we take about 2 to 3 hours to do.
And is that would that if it was someone was referred by their primary care physician, would that assessment be covered by their health insurance typically?
Yes, if no, if it's a medical referral. So let's say you're having trouble with memory,
Yeah.
yes, your insurance will cover that. If it's for financial capacity, your insurance will say that's not medical, and then that's something that
Got it.
we do differently. Yes.
Walk us through what a typical neuropsychological evaluation is like at your folks' office.
Do better. I'll show you a couple of graphs.
Oh,
Okay,
no.
so
Are these going to be less scary than the last graph?
yeah, so when we're talking about brain function, we're talking about different domains or cognitive domains. For example, your language. Can I show you a picture and you can tell me what it is? Or are you having some aphasia problems? I'll ask you to name some words. I want to see how fast your processing speed is. So name me all the animals that you can think of in a minute. and we're scoring it, and we compare your scores to people your own age, right? Wouldn't be fair to compare you to a 20-year-old because they're fast, right? Another thing we look at is attention. There's, I don't know if people know this, but there's two hemispheres in your brain, and different areas have different jobs, like verbal attention, that's left hemisphere for verbal language, that's over here on the right side is very visual spatial performance. So your visual memory and your visual attention, we're going to look at that, all these different networks separately. Memory, of course, that's usually what most people are coming in because they're really having trouble with memory. So we look at immediate memory, and then 20 minutes later, we look to see if you can hold on to that information. That's important because that tells us, is this amnestic or is this looking like Alzheimer's? This is one of the things we look. Verbal and visual memory, we look at those.
What's in your supplement stack for brain health?
Yes. So I take a multivitamin myself, and I take other things. As I'm getting older, I worry about my joints. So I take things for my joints. And Miley, she takes things for her bones because she's got a little bit of bone issue going on. So these are, if you're eating junk food, you're not getting any nutrition in your junk food. So you
Yeah.
need to supplement. And for the longest time, research wouldn't talk about supplementation, but now because so many people are having memory issues, they're starting to look at it and research and go, "Hey, look at this. Multivitamin can protect you from cognitive decline later." So that message is starting to get out there, and I've been talking about it for 20 years. And my nutritional neuroscientist, he lives and breathes that. He has his own supplement that he produces. So we're very much into, if you want to do it the healthy, natural way, that's what I live, is the natural, healthy way.
Okay, great. Any other supplements other than the multivitamin for brain health?
Sure. Now let me say there's certain things on the market. Just a multivitamin that's really expensive. The ones that have that jellyfish protein in them. Now, there's no evidence, there's no third party evidence that suggests those things are going to be
Okay.
any better than uh, just a natural multivitamin. Melatonin, by the way, as we age, we don't make much of it anymore. I take a melatonin.
Okay.
I did two-part because plaques and tangles, neurofibrillary tangles of Alzheimer's, there's two chemical pathways for it to develop. Melatonin will actually block one of those pathways. So I can cut my risk in half simply by taking
Oh, wow.
melatonin at night. Yeah.
Wow. Okay. Amazing.
Ginkgo biloba. Most of the world outside the United States, they've been using ginkgo for generations, and you can't make money off of it. So it's not really talked about here in our medical system, but
Yeah. Because you
there's
can't
research
patent
on
it.
it.
Got it.
You can't
Yeah.
make any money, but the research shows that if you take ginkgo, it can help also prevent some dementia decline.
Anything else in that category?
Turmeric, I mean, there's quite the list, but if you look at a huge country of India, they don't have nearly the dementia cases that we have. Well, why is that? Well, they started looking at the things they were eating. They eat a lot of curry, right? And
Yeah.
turmeric actually helps reduce and prevent amyloid plaque from collecting in the brain.